Hi folks, Dr. Ed Byer again. Today we're going to talk about why your doctor's not fixing your thyroid problem. Folks, the thyroid dilemma has multiple pieces to it, and your doctor's looking at one of them. If you're still suffering, you got to realize, if you don't realize it by now, there's so many other things that can be looked at that he or she's not looking at. One of the reasons why is TSH is an unreliable marker. Oh my gosh, that's like heresy to a lot of people when they hear that. Because that's the main marker your doctor's looking at. But let me tell you, in so many thyroid disorders, it's unreliable. Now let's review a little bit of thyroid physiology. TSH comes from the brain. TSH is not a thyroid hormone, it's a brain hormone. And it does exactly what it says it does. It's a thyroid stimulating hormone. It comes from your pituitary gland. And it notices, the brain, this part of your brain will notice when your T4 and a little bit of T3 levels are low, then the brain gets triggered if things are working right. A lot of times they aren't. And it'll release more TSH. So in a perfect world, and this, we don't live in a perfect world, when T4 or T3 drop, TSH should go up. That's why high TSH is related to low thyroid. But let me tell you, that marker is not so reliable, and here's why. The number one cause of underactive thyroid is an autoimmune disease known as Hashimoto's. Many of you who are watching this have it and don't know it. Some of you may know it because your doctor doesn't run the antibodies or the tests to really determine it. They're not really concerned in it. This is the only thing they look at. Now, 85% of the time in Hashimoto's, your TSH is going to be normal. And your doctor's going to just look at your TSH, not even look at your thyroid markers, and not even run the antibodies and say, everything's fine. And you go home scratching your head, frustrated, and wondering why you're gaining weight, tired, and losing your hair. Okay, number two, long-term use of hormone replacement therapy. When you're taking things like Synthroid or levothyroxine or even Armour, your brain's going to say, we don't need to stimulate the thyroid anymore because there's enough hormone in the system. And it gets lazy and your TSH is going to drop. And your doctor's looking at your TSH and saying, oh my gosh, your TSH is low, now it's time to go off the hormone, when they don't realize there's this feedback loop. They should, they're taught it in school, but a lot of them forget it. Number three, certain medications are going to lower TSH. A common one is metformin, which is used in type 2 diabetes. So, and a lot of my patients with thyroid problems have blood sugar issues, and they're on this medication, and doctors forget that this will lower TSH. The fourth reason is systemic inflammation will cause your pituitary gland to suppress, and TSH levels will drop. And the most common cause of systemic inflammation is what we put into our mouth or digestive issues. Number five, high cortisol will also suppress TSH and cause the pituitary gland to decrease in function, and that's a stress hormone. So if you're under any, not just psychological stress, but any physiological stress, over-exercising, or you have an anemia, or any other physiological stress that will cause high levels of cortisol. I'm Dr. Ed Byer. I hope that helps. See you next week.